Hello, this is Lauren Reyes, and this is my final research evidence-based project, the practice change of implantation into a clinical practice. I chose behavioral health as a practice change because it was one of only 2 in-person clinicals that I had. So as a person who is not in the healthcare field, I felt a little bit more comfortable in this area. The World Health Organization estimates that more than 264 million people suffer from depression worldwide. Over 16 million of those are Americans. According to Anxiety and Depression Association of America, 20% of patients with anxiety or mood disorders, such as depression, also suffer from substance or alcohol abuse disorders. Long-term substance abuse leads to numerous comorbidities, anything from cardiovascular disease, stroke, cancer, hepatitis B and C infections, lung disease, and further or worsening mental disorders. 10 years ago, the annual cost of depression to the United States was $210 billion. To put that in perspective, the U.S. Department of Education's fiscal year 2021 budget is $66.6 billion. We spend over 3 times as much on treating depression than we do educating our citizens. The WHO's Mental Gap Action Program lists physical activity as one of their recommendations for managing depression. This is in combination with standardized therapies like antidepressants and other structured psychological treatments. Biological Psychology published a study done on 61 university students diagnosed with depression. They placed them in exercise programs ranging from high-intensity interval training to moderate continuous training, and then one control group that performed no exercise routine during the study. Depression symptoms decreased in both the high-intensity interval training and moderate continuous training participants. However, only the moderate continuous training participants also had reduced pro-inflammatory cytokine TNF-A levels. The high-intensity training participants had lower depression symptoms, but in some cases, higher pro-inflammatory cytokine levels. All of the participants that performed no exercise had worsening depression symptoms. This correlation is common knowledge to many. Exercise improves mental and physical health. This study is important, though, because it shows that moderate exercise is significant enough in reducing depression symptoms and inflammation. It also shows that moderate continuous training may even be more effective than high-intensity training against depression. This is great news because one of the major symptoms and signs of depression is lack of motivation. The introduction of moderate exercise is substantial enough, and it is far less intimidating than referring a patient to join a CrossFit gym. A study is being conducted right now through BMC Psychiatry, looking at how moderate exercise 3 times a week may lessen depression. The study is involving 120 adult outpatients diagnosed with major depressive disorder. The researchers are focusing on 3 specific contributing factors to depression: poor self-esteem, pessimistic rumination, and negative memory bias. This ongoing study aims to find that exercise positively increases these factors in a person and therefore is helping in treating depression symptoms long term. The 2018 study published by Indian Journal of Health and Wellbeing found that moderate exercise and yoga is easy to implement and cost effective. The study found that depression worsens with poor self-esteem, negative thought processes, and lack of resilience. Many of the same similar factors to the BMC Psychiatry study ongoing right now. There's an organic release of endorphins during exercise. This is natural encouragement for patients to implement regular exercise into their lifestyle. They feel better, they enjoy it, they want to continue it. The more someone exercises, the better body image they have, which often enhances self-esteem and personal worth. These help to minimize the presence of negative ruminating thoughts that go along with low self-esteem, and both of which can help to make more sense in a person of negative memory biases, when now they're doing much better than they have in the past. A person exhibiting newfound physical strength and healthy habits can prove to themselves that depression can also be overcome. The patients in the Indian Journal of Health and Wellbeing study were able to see and feel actual changes in their physical strengths, their appearances, and their moods. Therefore, this provides validation to the patients, like, look how far I've come, look how strong I am, look what I'm able to do, look what I am doing. I can do anything. I propose selecting 3 inpatient patients from the behavioral health unit with a medical diagnosis of depression. Anything from major depressive disorder to situational depressive. Even depressive psychosis patients may be eligible if they have not committed a crime or have displayed acts of violence. They must have a new psychiatric evaluation by their psychiatrist and a physical exam. Their physician must approve them for moderate aerobic floor and standing exercise routines, performed 3 times a week for 30-minute durations each. The patient must be provided an orientation where they will be asked if they would like to implement moderate exercise 3 times a week into their current medical care plan, as well as to answer any questions they may have. The exercise routine requires no equipment. We will interview the nursing staff and the nursing aides who work with these patients to provide us with clearer pictures of relevant personality characteristics that may assist or hinder in the application of this implementation, as well as to understand any triggers the patient may have that they're aware of. The patients selected must be long-term patients who are being treated with stays for at least 21 days. Their insurances must be notified of the clinical trial and physician's prescriptive exercise implementation that involves no equipment and will be under strict medical professional supervision at all times. I intend to ask for volunteers from the hospital's physical therapy pool or local professionally licensed fitness trainers who have experience with depressed patients. These volunteers will meet with the behavioral nursing staff, including the aides, to discuss the routine of moderate aerobic exercise that is appropriate for these patients. 1 or more of the volunteers can put together a 30-minute standing and floor exercise that will be recorded on smartphones. This can be displayed easily on a screen for the patients or even via their phone directly in the event that they are discharged or would like to continue using the routine. There must be a nurse present during the exercise routines to provide continuous monitoring of the patient, as well as to offer therapeutic encouragement. A nurse must assess the patients prior to the exercise, inspect them during the exercise, and assess vitals after the exercise as well. This allows a unique opportunity for the nursing staff to be a part of a clinical trial, as well as to see for themselves and assess with their professional opinions the changes that they see exhibiting in the patients. I intend to use an explanatory clinical trial for practice change. This is fitting due to my practice change seeking to evaluate whether a moderate exercise routine 3 times a week on real patients in an optimal clinical setting can reduce their depression symptoms. We will examine the beginning depression symptoms that the patient has on record, the exercise implementation, and post-psychiatric evaluation of the patient's symptoms by the physician. We can use the contrast results found in the patient's evaluations to present to the board for further consideration of the same program with new qualifying participants. One barrier that I foresee is the scheduling of the exercise routine with the nursing staff. They have other responsibilities and other patients. I plan to use the private consultation room as the exercise space. There's plenty of space for 3 clients to work in. There's also a television monitor in there to view the exercise video. The participants must agree to work in a group 3-person setting to exercise. This will provide working in a 3-group exercise routine together. At the same time, will provide leniency to the nursing staff schedules, since only 1 nurse will have to oversee the exercise routine, taking up about 30 to 40 minutes with the interview and getting everything ready. It also allows the participants to encourage one another appropriately in a group setting. Inappropriate outbursts or uncooperative patients are another barrier that may be present during the routine. This should be met with encouragement from the nurse, therapeutic communication, and professionalism. The participants should be made to feel empowered by participating in these exercises. In the event that a patient is discharged earlier than the 3 weeks, the hope is that they will choose to continue to participate in the study on an outpatient basis or at home for the remainder of the time. Any participants that choose to stick with the exercise routine can perform the exercises entirely on their own via the phone being sent directly to their phone. Psychiatric evaluations will be conducted after the 21 days with each of the participants. This will help to compare the pre-routine patient symptoms to the post-routine symptoms. The nurse will conduct a brief, open-ended, and semi-structured interview after each exercise session. This will be to evaluate and document how each patient enjoyed the routine. Do they plan on continuing with the routine? What do they like best about it? Also, how do they feel? How does exercising make them feel? The questions should be framed positively in the interview, but if a patient has negative words to express, they should be met with therapeutic listening. In behavioral health, there are always unknown factors because patients exhibit mental, internal symptoms that can often be difficult to express. Ethical considerations during this clinical trial will follow the Belmont Report's ethical principles and guidelines for protection of human subjects of research. Each participant will be evaluated by their psychiatrist, who will deem them mentally and physically competent to participate in the study prior. The participants will be provided one-on-one orientations to the exercise purpose as well as what is expected of them during the routine before they sign any waivers and consent. What's expected is that they just try. They try for the full 30 minutes. If they can't, that is fine. It's just to encourage them to continue to try and participate. The patients will be under the care of professional nurses and physicians throughout the 3 weeks. Depression is the second leading cause of disability in the world. It is an immense economic burden to taxpayers. It affects adults and children from every economic background, every lifestyle, and in every country. The implementation into clinical practice is very much needed. Liabilities for facilities make it difficult to be the first to implement physicality into treatment plans. This small-scale clinical trial that I am proposing may be the first step to incorporating real physical change into our patients. Real change that may become lasting health promotion. Real change that is free, fun, and beneficial to every single cell in their body. Thank you.